Okay. Hello, everybody. Welcome to another session with DentalShadowers. Today, I'm welcoming Dr. Leung, a prosthodontist. Thank you for joining us, Dr. Leung. And whenever you're ready, go ahead and take it away.
Okay, thanks, Isabel. So first of all, I want to thank DentalShadowers for inviting me to do this presentation. There's a little structure that I was told to do this presentation, so I'll go with this template. So what I thought is I'll give you a little bit of introduction about myself. I was originally born in Hong Kong, and my family moved to Canada when I was 10. And then basically I grew up in Canada, in Toronto. So you can see the two pictures in Hong Kong and Toronto. And so basically I grew up in Toronto. I had my education there. So currently I'm a prosthodontist practicing in Toronto since 2005. And I own my practice since 2008. So this is a picture of my practice. You can see it's quite updated with all the COVID restriction, with the barriers and very limited seating area. So this is where I practice currently. About 3 years ago, what I also did was I went back to the dental school I graduated from, and I went into part-time academia. So I became an assistant professor at the University of Toronto since 2018. And my role there was primarily to be involved in the teaching of my specialty, prosthodontics, at the undergraduate level for the dental students, primarily the third-year dental students. So that's my background professionally. But what I want to share with you is I'm also a mom, a wife, and I'm a daughter. I have 2 sisters. So that's me personally and professionally. I wear many hats. So I hope that I can bring to the table of some useful information to you guys. And I understand that the audience are primarily university students who are interested in a career in dentistry. So I'll tell you how I became a prosthodontist. Basically, I went into University of Toronto and I completed 2 years of human biology. And this was many years ago, as you can see. At the time, that was the minimum amount of years that I can start applying. And I got into dental school after the 2nd year. And then I got into the University of Toronto. I did my 4 years of dental school. So after dental school, I didn't feel quite ready to be a dentist. And then I moved to the States. I moved to Boston, where I did a year of GPR, hospital-based residency. And the reason I went there is I love Boston. As a child traveling with my family, I fell in love with Boston. I just love the city, the college town. And so I just wanted to be there. So I picked a program that is based in Boston. And during that year, it was mostly a hospital-based residency. So I was seeing a lot of patients who are what we call medically compromised, really sick patients. And the program in itself, we had a lot of interaction with the oral surgery residents. And so I got to be at, working alongside with all the oral surgery residents. In fact, I was one of the residents who are taking calls at nighttime, just seeing all kinds of trauma cases, managing their inpatients. And so I was very lucky to see that aspect of it. And during the daytime, I would be seeing patients in the hospital setting, primarily really sick patients. Most of these patients had medical conditions. And at the time they had, I think that's called the Ryan White Grant. It's a government program that supports treatment for patients with HIV and AIDS patients. So I was seeing a lot of patients doing the general dentistry there. And what I really like that program is that I was also taking a lot of courses with the AEGD residents that was affiliated with the Boston University Dental School. So I felt I got both sides of the experience, because if after you finish dental school, a lot of people, if you're not sure, you end up applying to a hospital-based residency, a GPR program, or an AEGD program, which is more of a private practice setting. And so I felt like I was able to get a bit of both worlds. And that was when I felt that, I really fell in love with prosthodontics in that year, just from the interaction with the students and the faculty at BU. And then I decided to apply to prosthodontics. And at the time, I applied to BU because I was there already. But then I got accepted to what they call the BA program, which allowed me to have a stipend on top of being admitted to the BU Pros program. But then when I look at my overall costs, living in Boston is very expensive. And I decided I didn't want to take on that type of student loans. And so I decided to apply different programs in the Northeast region. And I applied to Northeast region only because by location, I wanted to be closer to home, to Toronto. So I got accepted to University of Pittsburgh. And that's how I ended up spending 3 more years in Pittsburgh doing my prosthodontic residency. And one of the highlights in this program is that at the time, they provide a lot of surgical training for the prosthodontic residency in terms of implant placement. So alongside with the traditional program of training the residents in prosthodontics, I had a lot more surgical training than other residents at the time. Okay. And on top of that, you can see that I kept myself quite busy while I was in Pittsburgh, because at the same time, I enrolled myself into the School of Public Health, and I did a part-time Master of Public Health program at the University of Pittsburgh. Now, you might say, why did I do that? I actually wasn't going to do a Master of Public Health. I ended up in Pittsburgh because I wanted to do prosto. But at the time, the Graduate School of Public Health wanted to cross-train a lot of the healthcare professionals, whether you're a medical student, dental students, in research in healthcare. They wanted to cross-train a lot of these people with their public health knowledge. And I didn't have to pay any other additional tuition. And so it was, I figured out if I could do that, why not? At the time, I was young, not married, and I had no family in Pittsburgh. And so I took up on this program at the same time. And it turned out to be a wonderful experience for me because it allowed me to see a lot of things from a different angle. As a dentist, as a dental student, you look at the mouth all the time. You don't really think about healthcare policy. You don't really think about health promotion. That Master of Public Health training really took me out of the patient care and allowed me to see how I can promote health at a different angle. So I see my efforts of promoting health a lot differently than if I never had that training. So that's my academic background, So after I've completed my 3 years of prosto residency in 2005, the same time I completed my Master of Public Health, I moved back to Toronto. So the next thing I wanted to talk about is, I'm not sure if any of you know what a prosthodontist is, and you may or you may not. That was one of the questions in the template that I was asked to talk about. So what is a prosthodontist? A lot of people know what an orthodontist is, but I still have trouble trying to explain to some of my family what I do as a prosthodontist. So I took these pictures from the American College of Prosthodontics when they were trying to improve the awareness of what prosthodontics is, hopefully to give you a taste of what a prosthodontist is. So prosthodontists, you can see here, receive at least 3 years of additional training beyond dental school. So it's one of the recognized specialty that you can pursue after dental school. Among like other specialty, there's endodontics, there's orthodontics, oral surgery, oral pathology, periodontists. So prosthodontist is one of the recognized specialty in Canada as well as in the States. And it means usually you need to do 3 more years after dental school, okay? And prosthodontists use cutting technology to provide innovative solutions. So to me, prosthodontists are problem solvers. We have many solutions to the patient's problems, but we use technology as well to help solve the dental problems. Prosthodontists, in layman's terms, I tell them, I'm a specialist in replacing missing teeth or missing tooth structure. I like to say that, you know, whether you're missing one tooth, 2 teeth, a multiple set of teeth, or even you have a set of teeth, but you've lost a lot of tooth structure. According to the American College of Prosthodontists, we are the specialists in replacing missing teeth. Sorry, my slides got a little. Okay. So the other thing is prosthodontists are the specialists for dentures, implants, crowns, and bridges and veneers. So this is the solutions that you might have heard of. You know, I need dentures, I need bridges, I need veneers, I need crowns. We are the specialists at doing these kind of, providing these type of services as well. So that's what, according to American College of Prosthodontists, you know, we specialize in these. Okay. So what else? Okay, so I hope I have given you a little bit of more information on what is a prosthodontist. To me, in layman's term, I'm a problem solver with many of the dental problems. I use technology and use materials. We have to understand a lot of the processes behind making prostheses. We provide a solution in the form of whether it's crowns, veneers, bridges, dentures, or combination of, you know, we don't just do crowns, we don't just do dentures. It could be a combination of things to meet the requirements, the needs of the patients, and they can come in all shapes and forms, right? So as a prosthodontist, I feel that I really need to understand the patient really well. I really need to understand all these solutions in a way at a very advanced level. I have to understand the materials, the steps involved, and to know all that and to find the combination of these solutions to see what is the best sensible solution for the patient. So it requires many levels of understanding patient's needs, the material that you're working with, what the solutions are, the advantages and disadvantages. Okay. So I guess one of the slides was, what's your advice for college? You know, is dentistry right for you? To me, you have to really understand what dentistry is, because there's a lot of commitment. Nowadays, I think minimum, you know, if you're trying to pursue this in the North American system, you need a minimum of 3 to 4 years of undergraduate education. And dental school are usually 4 years. And if you are going to pursue the specialty, depending on where you're going, what program it is, it may very well be 2 to 4 years or 6 years, depending on what type of specialty you're pursuing. In prosthodontics, most of the program is a 3-year program nowadays, okay? The cost of education, I may be a little off here, I'm not sure, because I've been out of sync about the current tuition fees, but the latest when I'm trying to look at what the tuition is for the undergraduate education, for dental school, and even postgraduate, you know, you can see that, you know, depending on the program, undergrad may be $3,000 to $5,000 a year. Dental school could be anywhere from $40,000 to $80,000 a year. And if you're going to pursue postgraduate training, some of them have tuition as part of the program. Some of them may come with a stipend that can offset some of the cost of living. Definitely for me, I selected Pittsburgh at the time because they had a stipend for me. And I only had to pay 2 years of a 3 years program in terms of tuition. So that was what I looked at. That's why I ended up going there. Comparing to the cost of living and the tuition, and in Boston, I felt that I could get, I wouldn't have to be in so much student loan coming out from graduate training. The other thing I wanted to say is the business of dentistry has really changed, and it's not that it's bad, but it's a lot different than when it was in the 70s or the 80s. That to me was the golden period, where you graduated, as long as you're willing to work, you'll be fine. You can find a job, you'll be busy from day one. That is no longer in existence, I think, pretty much anywhere, depending on where you're going. And so especially if you want to stay in the major cities, there's competition, there's many, so there's many factors to consider. And so while it is still a very stable profession, in my opinion, it does take quite a bit of work to get there in terms of schooling after you graduate, to be able to learn how to maintain your practice. So it is a lot to think about. And so if you ask me, is dentistry for you? These are some of the attributes that I thought would be important. You've got to be hardworking. It's hard. You got to be, in dental school, it's intense learning, lectures, lab work, clinical work. You got to stay on top of it. You got to be a well-rounded person. You got to be a people person. You got to be able to work with people, and just getting good at grades can only get you so much. And you have to be able to also work with your hands. Dentistry is very hands-on. And that is one thing that I wasn't sure, because I was never a hands-on person as a student in high school. And so that was what I fear when I got into dental school. It's like, am I going to be good enough? I had no idea, because I was never a person that was, with working with hands. I was never a person that was doing a lot of crafty things, So after now practicing, I realized this is a skill set that's very important for you to succeed. You have to be able to work with your hands, and also in a very small environment. A small environment that is moist, that has a tongue that's moving all the time, and you've got a head of a patient that you have to manage. Okay, so the procedure sometimes is very detail oriented. And so you have to work under pressure. You have to work with people. Sometimes you want to just focus on the dentistry, but you have to realize you've got the patient behind that. So they might be scared, they may not be ready. You got to be able to talk to them, explain the procedure. So, that is really the nature of dentistry. Okay, so that's what I want you to get out of. If you're not sure if dentistry is really the right career for you, I think the ability to work with your hands in a small environment, the ability to work under pressure, the ability to work with people is very important in my mind. You can be a very hardworking person. You can be very good with your schoolwork, and that will get you somewhere. But to be able to succeed in dentistry, I think this is very important, if you ask me. Okay. So I've been asked to share with you what a typical day would be for me. So I don't have a big dental practice. I would consider I have a very small to moderate sized practice where I'm the practice owner. I have an associate. I have an assistant. I also have 2 hygienists working with me. But my typical day, if I am seeing patients, is always start off the day with a morning huddle with my staff. Basically, we review the schedule together as a team. We overlook the potential patients that are coming through, the possible hiccups we might see, instruments, difficult patients that we have to anticipate, things like that. So we go over the day so that the front know what to expect, and my back staff in terms of the assistant know how to prepare for the day, so that hopefully it will be a smooth sailing kind of days, that everything will run smoothly. And then, of course, I go into patient care, which is what I do most of the time. And then at the end of the day, in terms of getting myself ready for the next day, I spend quite a bit of time reviewing the next day patients. Part of my job, because my job has, as a prosthodontist, I have lab works and components to order. I find that I do need to spend quite a bit of time at the end of the day to prepare for the next day. So then again, the next day will go a little smoothly. My work, because I make prostheses, I make dentures, crowns, and whatever, I have a lot of incoming lab cases. And so for that, in between patient care, I find myself I have to review these cases and make sure they are of the quality that I want. If there's something I don't like, I send them back. So part of my typical day, even if I'm not seeing a patient, in between patients, you'll find myself reviewing all the incoming lab cases, making sure that they are good, or just processing the outgoing cases, preparing for my prescription, getting all my pictures organized so I can email them to the lab, and reviewing the incoming reports and referrals. So all the other incoming letters, reports that I have from the patient and from the other referring dentists or specialists, I review them and make notes of them. And so that's also what I do on a typical day. At the end of the day, when I'm done with all that, that's more the business end of things that I want to share with you. Is I review my day end reports to see what I have generated. I factor in what my costs are. I review all the incoming bills also in between all that. And that's me wearing the business hat. I don't necessarily spend time to now pay the bills. I used to do that, but I wanted to have an idea of the expenses that are ongoing, so that is just how I manage my practice. I don't have a big practice where you have office managers to do this, you have that. So I do wear many hats, as you can see. So what I'm going to say is that, because I own my own practice, I am the practitioner. I am the one who's doing the dentistry, which is the bulk of my work. And this is why you're going to dental school for, okay? But what dental school really didn't prepare me for, the rest of it is just learning how to manage patient, which is understanding the psychology of patients, and also knowing how to run a business. At the end of the day, you have a business to run. You want it to be able to run it so there's profits. And so that aspect is just me learning on the job. And I always have to think about how I structure my day. Does it make sense? The time and the dentistry that I have to do. And this is just a learning process for me, just knowing how much time I need to do the dentistry and factoring, the fees and expenses and how to run it in a way that is profitable. The other aspect that I feel that we really need to know is, because I am the owner of the practice, even though it's a small practice, you're responsible for the hiring and the firing of the staff. And that is something that you never learn in dental school, but that is part of something I've had to learn along the way as a dentist, as someone who owns a practice, that you have to learn the art of hiring and firing. And the other thing is, it is a business that you're running. You have to think about how you present yourself in terms of the internal marketing and the external marketing, how you're representing yourself. Again, that's something that I have to learn, that I find myself at the beginning. I was reading a lot of the books on marketing just so I can understand the aspects. I didn't come from a business background. And that's another aspect that I felt I have to learn along the way in order to be a dentist. Again, I have a small practice, so every single problem falls into my shoulder. IT issues, plumbing issues, electrical issues. Not that I'm an expert on that, but everything I have to make a decision on what to do about that. So that takes away a lot of my energy sometimes from doing the dentistry I enjoy. But again, this is part of the package to be a business owner, to have your own practice. And the advantage of that is that you have control of a lot of aspects of your work. It is not for everyone, but that is my life right now. Okay. So the other aspect of questions is that what kind of complaints do patients present with? This is, I guess, what kind of problems do my patients present with? I think that's probably what this question was about. So as a prosthodontist, I see patients, obviously, I replace missing teeth. So obviously a good part of my job is I see patients with missing tooth or teeth. So I see patients who may be missing tooth congenitally, like they're born with some missing teeth. So that's what I see. Or I see people who had lost a lot of their teeth, either because of gum disease, cavities, or if they cracked their teeth, or they had accidents where they lose a good number of teeth. So I see those patients as well. I also see patients with terminal dentition, and these are patients, even though they still have a lot of teeth, they're about to lose all their teeth. Okay. We call this terminal dentition is like the end point there, you know, what to deal with these patients when they're about to lose all their teeth. So I have to rebuild and restore the aesthetics, restore their function. And so that's also what I see. The other thing that I don't think a lot of people know is that prosthodontists, I see a lot of complications from other patients who had years and years of dentistry. Complications like failed bridges, failed crowns, failed implants, failed dentistry that I had to see, because you know you're their last resort. You know, if they've had dentistry done, they've had several rounds of dentistry, and now everything's failed, and they really need someone with more advanced knowledge in dentistry to help them solve their problems. So that's why I consider myself a problem solver. You know, it's not like, you know, you don't always see what I call a virgin case sometimes, like a patient who comes to you with a missing tooth and there was nothing done to it. You often see patients who had many years of dentistry that have failed over the time, and now they come to you with their problems. And sometimes I also see patients, not because dentistry is difficult, it's just more of a patient management. The patients have high aesthetic needs, and you know, their expectations are very high that maybe the dentist felt that they cannot meet. And so I see those patients as well. So what kind of procedures do prosthodontists perform? So these are the solutions, I think, you know, that you might have been familiar with. These are the procedures, treatment that I can provide: crowns, bridges, implants, dentures, reconstructive. I call it reconstructive rehabilitative dentistry, really rebuilding their bite with any of these solutions or a combination of these solutions. And so while, like I said, I don't just focus on crowns, I don't just do implants, I do all of them depending on what the patient really needs. So that's what I do. So now I think I was told that cases are interesting for you guys. So I just want to share with you the rest of my presentation, some of the interesting cases that I've done. So this is a patient that I saw a few years ago, and I really like to show this because this is actually a college student who just went back to school and is about to complete her college degree. And she said that she needs to fix her smile so that she can get a job. And so you can see that there's a lot of crowding. You can see there's brown stains, there's cavities. And so by the time I saw her, she had to see a root canal specialist to do retreatments, because these teeth had some root canal done that had persistent infection. So I told her, we can improve both the position and the color of these teeth by providing her crowns, because they're heavily restored, so I can correct all that. And she also had a round of whitening just to improve the color. And so by the time she came to see me, the second picture here is in 2 hours, I prepped these 4 teeth for crowns, and these are my temporaries. And so I can see the instant improvement, and the patient just was so happy. And I feel good because I know that she wanted to really improve her smile. And these are the permanent crowns, the porcelain crowns that were inserted. The key is just, you can really change a life by just doing these are just my temporary crowns. Just knowing how to develop the contours, the shape of your temporaries. I love this part of it because I know that from this to this in 2 hours is life-changing. And from this to this is just nice. You finish the work, but you know that from here to all the way to here is really life-changing for the patient. So that, it's just 4 single crowns, but it is life-changing. And I know that she will be so happy to go out and for her job interview. Okay. So this is another case that I wanted to share with you, which is an example of patient with terminal dentition. This is a patient who's in his 20s. And this is a typical presentation with a patient who have a history of recreational drug use. We call this meth mouth. And so when he came to me, it was, we know that he's going to have to lose all his teeth. He's only 20 years old and he doesn't have a job. But what we end up providing him with his parents' involvement was that the oral surgeon placed 4 implants and I made him an overdenture. And you can see the smile that I've provided for him is, it really is a big improvement to what he had before. So even though he's wearing what we call an implant overdenture, it is a removable prosthesis. You can see that it can be a very natural looking smile. And in his words, he tells me he can eat anything he wants. So this is also life-changing. This is allowing him to fix his smile so that he can go out and get a job and feel good about himself. So that's what I feel that I can contribute to the life of, to improve the life of my patients through my dentistry. Is just giving them the confidence, giving them back the smile that they need in order to survive in the society. So this is the third case that I wanted to share with you, is that this patient is in her 80s. And when she came to see me, she was at this stage. And I don't know, in her 80s. And what I end up doing is, at this point, you can see the teeth are all flared out. These teeth are very loose, had, a lot of periodontal disease. They're very loose. And at the time I had to stabilize these teeth because they're just about to fall out. And I made her an immediate complete denture. On the day I made her an immediate complete denture, you can see that the roots are practically resting on the gum. I took out all the top teeth. I made her an immediate complete denture. So I first stabilized her first with a complete denture. Then what I did was, her bottom teeth are also not the greatest in terms of, the bone support. So I ended up removing all her teeth and placed 4 implants. And within that period, I converted her denture into an implant supported bridge, which is a lot more comfortable. So this is also a very life-changing experience for the patient. This patient waited all this time. She's in her 80s. And I guess it's fear of not knowing what happened to lose all her teeth. And by the time she was referred to me, I knew that, she know that she needs to lose her teeth, but she wasn't sure if she's going to spend the money on implants. But I needed to stabilize her with an immediate denture. Eventually, she gained more confidence in me, and I ended up treatment planning her for 4 implants in the mandible and 4 implants in the top. So I'm just about to finish this case up now, but this is also a life-changing experience for the patient that I want to share with you, that I feel that's what I do as a prosthodontist. It's life-changing. Just trying, she's put it off for many years. She's in her 80s. Even though she's in her 80s, she's very healthy. And I still, I was able to give her back the smile and give her the confidence so she can go out and be comfortable and interact with the world. So that's the 3rd case. This is a patient, and I mentioned I see complications. I see patients with failed dentistry. And so this is an example that I want to share with you. This patient, you can see that she had braces. She had braces to correct the alignment of her teeth, but you can see there's a huge defect here. And it was kind of a sad story. Somehow several of her front teeth were infected. It was abscessed, and after several treatment, it was deemed non-restorable, but it left a huge defect here. And initially, this patient was planned for implants, for bone grafting implants, but then there was no bone. It didn't work. There was the bone grafting failed. And so now the orthodontist felt that she needed something to restore her smile. And so that's how she referred to me. So, because it's in the front area, you're looking at different prosthetic options, that because the initial treatment option was not possible because of the failed dentistry, it didn't work, then I get to see the patient as a last resort, and I need to provide a solution for this patient. And she's quite young, she's in her 20s. And with this defect, I had to struggle to determine, do I provide her a fixed solution, like a bridge, because no implants are no longer an option, there's no bone there, or a removable solution or a fixed solution. A fixed solution meaning a bridge meaning that I use teeth on each side to support the replacing the missing teeth, or a removable solution meaning I have to give her a denture. I had to struggle quite a bit because with this amount of defect, this doesn't really show this true defect. I was quite worried, and these teeth are virgin teeth. I wasn't excited about filing these teeth down, but she's a young person. I know that if I give her a denture, she's not going to feel like she's herself. So I struggled quite a bit, but in the end, based on her bite, the amount of forces, I ended up giving her a bridge, and the bridge coming from this tooth to these teeth. So this is the bridge coming this tooth all the way to here. So it is a long span bridge, and replacing quite a bit of missing tooth structure and soft tissue. But and I think the end result, she was very happy. And even my receptionist mentioned that, the moment you started treating her, you can see the personality change. She started dressing up, putting makeup on, instead of, the low self-esteem that you see her coming in stressful and anxious. And that's the type of changes I often see. They come with high level of anxiety. They've had several rounds of dentistry that failed, and you're trying to provide a solution for them that hopefully will improve things. And so that is really what I want you to realize, what the prosthodontists do. It's not just providing the solution, you're actually giving them hope and improving their quality of life. So this is a patient where has a congenital missing lateral incisor. This is actually one of the rare cases that was worked up so nicely that I actually have to focus on the dentistry. This was referred from an oral surgeon who actually placed the implants, and before that, the orthodontist had moved the teeth to manage the space really well. to the point that I didn't have to do much. I just have to trim implant to 2 implant crowns. And my job was to get the lab to make these implant crowns to look at as perfectly as possible. And I think we've really created a nice natural smile for these patients. So that's another type of patients I see. I see patients with congenital missing teeth, multidisciplinary cases where they had to go through ortho braces and from an oral surgeon who might have done bone grafting and placed the implant. And for me, I finish up with restoring that gap to give her the smile that she wants. Okay. So a good portion of my patients are geriatric patients. They're old patients with a lot of wear and tear on their existing dentition. So what I want to show you is this is a patient that came to me, and you can see all her remaining teeth are really worn down. And for me at the time, you know, I could really build these up with crowns and bridges and dentures, which to me will take a lot more dentistry. And she's got back problems and can't tolerate long procedures. So instead of the traditional concept of salvaging these teeth, what I thought was more efficient was to remove these remaining teeth, place a couple of implants. Here, there's 1 implant here, 1, 2, 3, 4, 5, and I think there's another one here. I placed 6 implants for this patient, and I end up restoring what we call an implant bridge. And so this also is life-changing because she couldn't eat with what she had. Her bite was collapsed. And here I was able to restore the bite, the aesthetics, and give her something fixed much more efficiently than if we had to use her existing teeth. So that is the type of dentistry that I can provide for the patient. Now, I also said that I don't do just crowns, I don't just do dentures, I don't just do implants. This is a combination case that I had provided for the patient. And again, you can see she has existing dentures, but she really doesn't like the appearance of her front teeth. And so she wasn't interested in implants at the time. And what I really did was just I gave her new crowns on the top, front teeth, and new dentures. So again, you know, based on the patient's needs and aesthetic needs and the functional need, I don't always have to do implants or very complicated things, but, you know, just with some new dentistry, you know, with crowns and denture, you can restore the smile and give them an improvement in their function and as well as their aesthetics. So let me see. Okay, 2 more cases and we're done. This is a patient that had some ortho done, but she didn't follow up. And she ended up having a lot of root resorption on the remaining front teeth. And she also was quite young. And so I had to work with an orthodontist and a periodontist. And what we ended up doing was that we decided we needed to, she's going to end up losing her 4 remaining teeth in the front. And you can see she has a moderate smile now where you can see a bit of the gum. And that is the challenge. She's quite young. I don't want to remove more teeth, and I don't have to, but trying to restore the space where she sees, you can see her smile shows a bit of the gum is a challenge. And so from day one, I did tell her, you know, we're going to try to do the best I can, but the transition where the prosthesis is meeting the natural teeth, it may not look always as natural. And I sometimes call these black triangle spaces. And we'll try to do the best. You can see that the prosthesis has a bit of what we call pink prosthetics. So here you're not just restoring the crown, you're also restoring the missing soft and hard tissue. And so she ended up having 3 implants to replace the 4 teeth here. And so again, you can see in the beginning, she was hesitant to have that done. She put it off. and then she knows that she can't put it off anymore. And when she's ready, then you can slowly see that she's gaining confidence and coming for the appointments, and finally getting the final treatment. You can see that she's very appreciative of the work and the time that you spend with her. So that is what I consider a success, trying to restore the patient's confidence and the smile. Okay, last case I want to show you is, this is a patient. You can see in the middle top is that the patient has wear issue. You can see, I call this a roller coaster plane of occlusion. You know, it's up and down, up and down. And really the patient came to me because she really doesn't like her smile. She doesn't like her smile. If you look at it, if you learn how to evaluate what is considered aesthetically pleasing, she has a lot of the features that doesn't look pretty. You know, we got this reverse smile, the incisal edges are not following the lower curvature of the lip, and you can see that it's because of the wear. And so I end up giving her reconstruction on the top teeth with crowns and bridges. And you can see that the smile, if you look at the elements of what is considered aesthetic, you know, now the incisal edges of the front teeth is following the lower curvature of the teeth, and she is very happy with the aesthetic outcome. And this is the completed case. So this is another case I feel so good about, because the patient was told she couldn't fix the smile unless they go through jaw surgery and braces. And I reconstructed her with just, you know, with crowns. Obviously it has to be tested. You don't go from here to here in one day. It actually takes several months of treatment to work out the aesthetics and the function to make sure this is acceptable before you can finish it. But this is also, to me, a life-changing treatment that I enjoy providing for the patient. So I guess that this is my last slide. If you, I included this here. Now, this is, if you have time, you can go back and read this is a review that patient have given me. And I'm not a big fan of reviews, because review shows you an extreme, and you either have a very unhappy patient or a very happy patient. And this patient told me that she is so appreciative, she will give me a review. And so she gave me a review. I just want to share with you. And this patient happened to send me a picture of her selfie at 2:00 in the morning because she couldn't sleep. And that is the type of job satisfaction that I have. And for the record, all I did was I gave her a set of dentures, nothing fancy, but just knowing how to set the teeth correctly. She didn't have the funds to do anything fancy more than just a set of dentures right now. But she was so nervous about moving to that step of losing all her teeth. And when she saw her smile, and she was just amazed about that smile, and she sent me a selfie and she gave me this review. And that's when I know that I've made a difference in her life. And that's what I mean, that I feel that my job, dentistry, can be very life-changing. And that's what I enjoy every day of my work. It is difficult, it is challenging, it takes a while to get there. And if you wanted to have that type of satisfaction, I guess my advice for you is be ready to work hard. You just have to work hard and know that Rome was not built in one day. You don't get to this point of satisfaction just from finishing dental school. In fact, that's when you start working really hard. That's what I learned. You know, you think you've done so much. You got into dental school, you finished dental school, you've passed all your exams, you've done everything. When you start practicing dentistry, that's when, to me, you start learning dentistry. And it's, you know, I finished dental school 20 years ago, okay? And I'm still learning every day, and I enjoy learning every day. And I set what are my goals for the next 5 years. And this is what's going to push me, because I want to help patients. I wanted to restore their smile. I want to help them regain their confidence when they lost hope in life. And that's what I feel that my job can provide for my patients. And so I'm so passionate with my job. If you follow my Instagram account, I share a lot of my prostho knowledge with my dental students. And I also have a blog on my website. If you wanted to know what type of dentistry a prosthodontist do, what kind of things I do, what kind of things I struggle, you're welcome to visit my blog. And I hope that will give you a perspective of what a prosthodontist do. And that's it.
Well, thank you so much, Dr. Leung. That was so informative, and all the cases were super interesting. I really enjoyed it. So now we're gonna have Yoon here read some questions from our live stream chat. And so go ahead, Yoon.
The first question that we have is, what differences did you experience during your residency in the US versus Canada?
It's a different philosophy. And so every dental school, dentistry is very regional. And what I learned was that after I graduated from dental school at U of T, and when I did a year of GPR residency in Boston, I realized there's a new philosophy that I wasn't exposed to. And so I think that's why I choose to do my additional training in a different setting, different school, because I want to be exposed to different thinking. In general, I think the undergraduate training, if I spent more time in Pittsburgh because I did 3 years there. So the undergraduate training and philosophy is very similar to U of T. But I think the BU training is quite different in terms of the prosthetic approach at the time. So it's not that one is better than the other, but it does give you different perspective on things. And that's what I like about doing my training at different locations.
The next question that we have is, what made you want to get into dentistry?
Good question. So I didn't mention it at the beginning. So I was always very strong in science, and I actually wasn't going to I didn't want to go into dentistry. I actually wanted to do physiotherapy. I actually did a co-op in high school, wanting to become a physiotherapist. So I spent a good school term job shadowing physiotherapists. And so when I applied in at the time at the University of Toronto, the requirement to go into physiotherapy kept changing. So when I applied, they said you need 1 year of undergrad instead of going straight from high school. So I did 1 year of undergrad. And then after 2 years of undergrad, they changed the requirement that you're now 3 years of undergrad. So I'm like, at the time at U of T, the minimum requirement was just 2 years. And I figure I can apply to dental school after 2 years of undergrad. And so I really didn't go into dentistry with the same type of preparation, but I had very good marks. And so I got into dental school. But I have to admit, I was very nervous because I was like, I didn't know anything about dentistry. I didn't know if I was going to like it. And so that I lucked out. I really felt I lucked out because I wasn't a person who likes to work with hands. I wasn't a person, I didn't think I would enjoy looking at someone's mouth all my life. And so it was really during dental schools that, actually I can do this. I can actually prepare a crown. And I was told these preps look good. And it's just over the years with different input from instructors, I realized I can do this. And then the more I learned, the more I was exposed, that I got more excited about it. And then and I went into a specialty in prosthodontics. So I really didn't think much. All I know was that my mom told me that you should go into dentistry because it's a good lifestyle. So that was why we were looking for something that is stable, good lifestyle. And so when I was in the midst of applying to physiotherapy, and I thought, oh, let me just apply to dental school. Let's see what happened. And I got in, and I figure, well, I got in, so why not, right? So I lucked out on that aspect.
Where did you learn how to run a dental practice?
Well, I just from, I should mention, when I was a dental student, actually, after I got my acceptance letter, I actually decided to work at a dental office. I wanted to work in a dental office to understand the business of it, because I realized, you need to learn that. So at the time, I remember I walked into 50 different dental offices to ask for a job. I was just, a university student. I said, I just wanted to learn about the business of dentistry. If you're looking out for a summer student. So that year was when I learned about how to run a practice, really. I was working as a receptionist, initially just filing away the charts, answering phone calls. Eventually, I learned about insurance. I learned about scheduling patients. I learned about, getting predetermination estimates. So I actually learned a lot more about the business side of dentistry before I learned dentistry as a dental student. So that was what gave me the confidence. Even when I finished dental school, I felt like I was ready to own a practice. I didn't end up opening a practice. I actually ended up buying a practice, but I was never afraid of running a practice because of that experience. So I'm going to say that really changed how I take my initial step after I graduated. After I graduated and I did my training in Prosto, I felt like I've learned a lot of the dentistry. And because of my previous experience as a dental receptionist when I was working as a summer student, that gave me the confidence I can run my practice. And on top of that, after I owned my practice, I read a few books on marketing and, just running dental practices. It's just really learning on the job, so.
As a Canadian student, how was your experience going to the US to continue your studies and then coming back to Toronto to practice?
So I felt it was because I went to dental school in a Canadian dental setting. I understand I have many friends who are dentists already. And so coming back wasn't that hard because I already know how the dentistry is. Other than trying to remember the tooth number, because in the US, the tooth numbering system is different than in Canada. And so coming back wasn't that hard, but I was told when I met some of the Canadian who did their dentistry, everything in the States, coming back to a Canadian setting was a little harder, especially if they're a specialist, because part of this, your specialty is you need to network with other dentists. And so initially they feel that it was harder for them to get back into the market, to know the colleagues and to get referrals from the dentists. But for me, because I did dental school in Canada, and even though I did most of my specialty training in the States, for me to come back, it wasn't that hard for me at all.
You said patients present with congenitally missing teeth. In your experience, are there any teeth that are the most common to be missing?
Can you repeat that question again?
So you said patients present with congenitally missing teeth. In your experience, are there any teeth that are the most common to be missing?
The lateral incisors are very common. Okay. I also see a lot of patients with syndromes that have more than one or two missing teeth. So you've got, I see the premolars missing as well. And so, but I would say people who are referred to me mostly are the congenitally missing lateral incisor, because they're missing in the front. So there's an aesthetic element to it. And so the expectation, the demands are also higher. And so I get more referrals on those cases as well.
And I think the last question that we have for today would be, do you think it would be worth it to go to the States for a dental degree as a Canadian student?
I think so. We have many people who went to the States for their dental education. I actually, now that I've, this is 20 years ago, a long time ago, I think, going to the States for dental education is not a bad thing. You get to see more and do more. And if the opportunity exists, why not? It used to be 20 years ago, the tuition was a lot higher going to the States. Now the difference is not so much anymore. And so I really think if you wanted to be a dentist, it's not really where you get it. It's your mindset, your attitude. And once you get that degree, it's how you utilize that degree to your advantage to help your patients. And so every school will offer something different for you. And if you have to find something that you enjoy, right? If you feel this is the school for you, then go for it, you know.
That's all the time we have for questions today. Thank you for taking your time to answer those.
Thank you so much for having me.
Yes, thank you, Dr. Leung. We really appreciate your time and your knowledge. And thank you to the viewers for tuning in. Just a reminder, the quiz can be found in the chat. It can be found in the GroupMe and also the Linktree on Instagram, and it'll be open for 12 hours. And yeah, thank you, Dr. Leung.
Thank you again.
Thank you.